I'm Dr. Robin Chatkan, and welcome to Office Hours. Today we're going to be talking about constipation and the gut microbiome. And the first thing I want to say to you is there are very few areas in medicine where we can draw a straight line between, something that may be going on and a symptom, because so often there are multiple things contributing. And constipation is a great example of that. So when we look at people who are constipated, we see the contribution of anatomical differences. Many of you have heard me talk about the voluptuous venous colon. We know that in women, the colon is longer, it's more twisty and turny. It has to compete for space with the pelvic organs. So all of these things can end up conspiring to constipate us, but there can also be other contributions. There can be something you're taking in the medicine cabinet. Maybe it is a calcium channel blocker for high blood pressure, or a vitamin with iron in it, or an antidepressant, and that can also be contributing. Maybe you're not drinking enough water. Take a little sip for that one. And that can be contributing. Maybe you're taking your phone into the bathroom and you're sitting there for long periods of time and you're giving your bowels that negative feedback about evacuating. So there are lots of different things that can contribute. And I always like to remind people that constipation is a symptom rather than a condition onto itself. And there always are reasons why, when we really roll up our sleeves and investigate, we can always come up with the reasons why things are slowed down, and sometimes multiple. So that being said, let's talk about dysbiosis, disruption of the gut microbiome, as a cause of constipation. So by way of background, and I know many of you know this, but for definitions, the microbiome refers to all the organisms that live in and on our bodies, mostly in our GI tract. And when I say organisms, not just bacteria, but also viral organisms, viruses, fungal organisms, parasites, archaea, protozoal organisms, those one-cell organisms. So all of them constitute our microbiome. And believe it or not, some of these other organs, like the viruses and the fungal organisms, also have a role in our gut health. So despite what you may think with the COVID pandemic and what you're always hearing about Canada, not all viruses, not all fungal organisms are bad. Now, when we talk about the family of gut bacteria, the different families, because in the gut microbiome, we're mostly talking about bacteria. There are four main families of bacteria in the human gut, and those are Bacteroidetes, Firmicutes, Actinobacter, and Proteobacteria. And there's not going to be a quiz, so you don't have to memorize those. But I say that because what we find is that in people with chronic constipation, particularly people who've been diagnosed with IBS-C, irritable bowel syndrome, constipation subtype, we see disruption of the gut microbiome. We see what we call dysbiosis. And what we see specifically is a decrease in the levels of actinobacteria. And remember, actinobacteria are a big phyla. And below phyla, we have class, we have genus, we have species, etc. Right? So we're talking about big families. And from phyla, we go all the way up to domain kingdom, or it's kingdom domain. No, I think it's domain kingdom. I forgot my taxonomy. But again, what we see is we see a decrease in actinobacteria and an increase in Bacteroidetes. Now, the thing I want to point out is that association does not equal causation necessarily. So because we see increases in certain type of bacteria and decreases in others, that doesn't mean that that is necessarily what is causing the constipation, but we also see an increase in what we call the methanogenic bacteria, the methane-producing bacteria. And we know that sort of overrepresentation of these methane-producing bacteria can be associated with constipation, and not just constipation, but bloating and a decrease in gut motility. So something about these methane-producing bacteria can slow down gut motility. And it's not just the methane. So one of the ways that gut bacteria can cause constipation is by producing metabolites, what we call postbiotics. And for a little bit of definition, a prebiotic is the food that you eat that stimulates the growth of gut microbes, gut bacteria. And take a note of the fact that I said food. I didn't say prebiotic capsules, supplements, and all the other stuff people are trying to sell you. Food. So typically high fiber foods. Prebiotics. Then we have probiotics. Probiotics are the live bacteria themselves. And then postbiotics are the metabolic byproducts of bacteria. And so we know that some of those metabolic byproducts can actually suppress gut motility. They can slow down the movement of the products of digestion trying to make their way from north to south, from in your mouth to out your butt, right? So that can happen. So depending on what your gut microbiome looks like and what the representation of different species are, the post-metabolites, those metabolic byproducts that the bacteria are churning out may be different. And your gut microbiome may be churning out more metabolites that are suppressing your gut motility. So that is one of the other major contributions. And then let's talk about the association with diet, because of course it all comes back down to not just what we're feeding our cells, but what we're feeding our gut bacteria. And we know from the 2018 American Gut Project study, which I'm fond of quoting, that the most important factor for determining the health of the microbiome is what we eat, and specifically 30 or more different plant foods per week is associated with a healthier, more diverse, more robust microbiome. What else do high fiber foods do? Well, they bulk the stool and they help move those same products of digestion from north to south. So again, what you're eating, and particularly the amount of fiber in your diet, plays a role not just in providing more bulk to the stool so that it's easier to move through and to expel, but also by having a direct and profound impact on the composition of your gut microbiome, which will also determine the different post-metabolites, etc. And that's why it's very difficult to get away from the food. I mean, you can't hack this. You can't just, I'm going to just go take some probiotics. That may help to an extent, but you really have to focus on the diet. What are we feeding those gut bacteria? Because if you're just taking a probiotic, but you're not really changing the ecosystem, you're probably going to be pooing out most of those bacteria. They're not going to colonize, and you're not going to see meaningful colonization and change in the composition of the gut bacteria. So that's why it really does, a lot of this boils down to the food, right? And I think I used an example of, I could go get a cheetah from the plains of Africa and put that said cheetah in my backyard. But if I weren't reproducing that environment, if the cheetah had just a backyard instead of hundreds of miles of savanna to run around on, and I was, feeding the cheetah dog food or some other such, terrible idea, rather than wild game or whatever the cheetah is managing to catch, that cheetah is not going to thrive in my backyard. So again, we have to think about what we want the habitat of gut bacteria to look like in order for our gut to be healthy and for things to work well. And a big part of that is what we are feeding these gut bacteria so that they can produce those healthy metabolites. Another one of those post-metabolites is something called short-chain fatty acids. And you've probably heard me talk about this before. So short-chain fatty acids are one of the byproducts that are produced when gut bacteria ferment high-fiber foods. And short-chain fatty acids are essential for the colonocytes, those intestinal cells that are making up the gut barrier, and we want those cells to be healthy and we want them to stick together so that we don't have an increase in intestinal permeability. That's for another time. And so these short-chain fatty acids, having sufficient levels is important for having a healthy gut lining. They're also important for having a healthy immune system. It turns out they modulate the immune system. They're also important for gut motility. So again, we have to go back to what we eat so that we can produce balanced amounts of these different substances. So again, these are some of the ways, and to recap, we see in some instances, not all, a decrease in actinobacteria as one of the phyla, the large families, an increase in Bacteroidetes. Within that, we can see differences in certain species too, Clostridial species, Veliola, different things. But again, we don't have data to say that this particular bacteria will get your gut moving and this one won't, right? These are sort of broad brushstrokes, but we can, again, additional data showing that high levels of methane producing bacteria. And when we do a test, a Sibo breath test, a test for small intestinal bacterial overgrowth, which I think is not a particularly great name for describing dysbiosis, because it makes you think it's overgrowth, when sometimes there's overgrowth, but often there's undergrowth, right? We're missing essential species. And, the whole reason people use that term, it's really sort of encouraged by a pharmaceutical company to make you want to treat it with an antibiotic, which when you think about it, something that's caused by too many antibiotics, the idea that can be remedied by yet more antibiotics is a little bit of magical thinking. And so what we see is people who have SIBO who are treated with antibiotics they feel better initially as the bacterial levels drop, but as they regrow, things grow back even more imbalanced, and the symptoms tend to reemerge, sometimes worse. So what we see though is with that Sibo breath test, we're usually measuring hydrogen and methane, and we see that people who have high levels of methane on that breath test often are quite bloated and constipated. Not always. I've had patients with high methane levels. Depending on what test you're using, the cutoff is usually 10. So I've had people with methane levels of 30 and 40 who aren't constipated. And I've had people with normal methane levels who are very constipated. So this is not a reliable test for saying, aha, the cause of your bloating and constipation is you have high levels of methane bacteria and here's an antibiotic. Really doesn't work that way. But we do see that dysbiosis and Sibo, a marker in some people, are the high levels of methanogenic bacteria. And so again, how do we manipulate the microbiome post-birth, right? Because we know that what we eat as mothers can affect our baby's microbiome. But let's say you're already a full-fledged adult, right? So, you've already been born. What can you do to impact your microbiome? Well, again, I like to think of it as remove, replace, restore. Remove drugs, practices, offending agents that are damaging your microbiome. So that would be things like antibiotics and acid blockers and all the different prescriptions and sometimes over-the-counter drugs, non-steroidals, that we know are problematic for gut health. To try and eliminate those, decrease them, use something else, always with the cooperation and advice of your healthcare practitioner, not based on what I'm telling you. So that removal of those offending agents is important, because if you're trying to fix your microbiome through manipulating your diet or whatever it is, and you're changing your diet or you're taking a probiotic or you're doing a combination, but you are still taking proton pump inhibitors, acid blocking drugs for some reason, or you're still taking antibiotics frequently, it is like trying to fill a bathtub with the plug out, right? You're not going to get very far. So the remove part is really important. And with that remove, I would also think about certain foods that we know are not the ideal foods for creating a healthy microbiome. So that would be, for example, ultra-processed foods, having high levels of animal protein and not enough plant fiber. The replace is, how are we trying to restore some of those essential species that we've lost? And one great way to do it is exposure to nature, to soil microbes. Now, whether that means you're out there, rolling in the dirt, or going for a walk in the woods, or you are buying food that is grown in microbially rich soil. So ideally from the farmer's market, food with dirt on it, because that's the other place we get our microbes after birth, is from the soil. Or it may be a robust probiotic. But I want to point out that probiotics have a minimal role here. It's pretty rare that I see a constipated patient and they do nothing but take a probiotic and they're good to go. That is pretty rare. It typically is in conjunction with dietary change, okay? So that's a replace. And then the restore. How do we restore the health of the microbiome? By feeding microbes lots of plant fiber. And, I wish I could make it more complicated and sexier than that and invoke the Krebs cycle and complicated things. But at the end of the day, what we feed our gut bacteria matters greatly. It matters greatly for gut function. And trust me, if there were some magical pill out there to take, I would have told you about it, right? I would be making $1 gazillion selling it to you. But that really does not exist. So what I have found in my 31 years as a practicing physician and my 28 years as a gastroenterologist is that good gut health is so often about stopping something you're doing that is hurting your gut compared to adding something in, right? There's not usually, just take this pill. It's usually, no, let's stop taking the non-steroidals, the antibiotics, the proton pump inhibitors, the antidepressants, whatever else. And I realize that it's not just a simple matter of just stop your antidepressant. I would never suggest you do that. But to really think about those things in the medicine cabinet that are messing you up, right? And then to really think about practices that can help and not, anything like super difficult to do, but just drinking enough water. Hydration, it's plumbing. Move things from north to south. Think about the contribution of plant fiber. And you don't have to be a vegan. I am not a vegan, but I eat a lot of plants because I recognize the value to my overall health and specifically my gut health. Every time I sit down, I eat a salad, I eat some chickpeas or whatever it is, I am very aware that that food is information. It's feeding my gut bacteria. It's really pointing in the direction of making certain metabolites, etc. So I consider it, essentially part of my self-care and part of, the medicinal things that I can do in my everyday life. So these are, again, really important practices: drinking enough water, eating enough high fiber foods. There's definitely room for meat on the plate if that is your preference, but you've got to get in those high fiber plant foods. So what am I talking about when we think about that American Gut Project study that said 30 or more different plant foods per week was the most important factor for a healthy gut microbiome? We're talking about fruits, vegetables, nuts, seeds, whole grains, legumes, that's beans, herbs, spices, all of it, right? All of it. It's not just eating kale salads every day nonstop. And a green smoothie, of course, is a great way to get that in. Mine, I typically use a water or coconut water base. I do kale and collards, sometimes some spinach if I have it on hand. I do a stalk or two of celery. I do a little parsley and mint just for flavor, a squeeze of lemon, and some fruit for flavor, give it a little sweetness. I like mango if I have it, but if not, my favorites are pineapple and kiwi, which are both fruits that are high in enzymes. Pineapple has bromelain in it, and kiwi is one of the most helpful foods for constipation, prunes and kiwi. In some of our clinical studies, kiwi and prunes are more effective than medications like Miralax and Linzess for constipation. And obviously they have other benefits as plants that are full of phytochemicals. So again, what I found in my experience is that these diet and lifestyle things make a tremendous difference. I can solve, I would say, 30% of constipation just by increasing people's levels of hydration. And a dehydrated gut, from a gut microbiome point of view, is also problematic, right? Because water is part of that gut ecosystem. So if your gut isn't adequately hydrated, chances are the products of digestion are stagnating in different parts of the gut, and that's also affecting your microbiome. So just something as simple as water, and just let it be water. No vitamin water and alkaline water, and just water. Perfect. For hydrating the gut. That also makes a difference for the microbiome. I also want to talk here, before I stop talking and take some questions, about the gut-brain connection, because we know the gut microbiome is very, very closely associated with what's going on in your brain. And that is bidirectional communication via the vagus nerve and neurotransmitters. So let me talk a little more specifically about how that gut-brain connection works. The microbiome is where a lot of the neurotransmitters are produced. Things like serotonin that we think of as a feel-good hormone, 80 to 90% of it is produced in your gut, as well as other neurotransmitters where it turns out gut bacteria, if they're not directly making it, they're important co-producers for these hormones. And obviously these different neurotransmitters can affect our mood and behavioral things, cognition, etc. Now, the bidirectional piece is the brain also has an effect on the gut, on gut motility, and on secretion of different digestive enzymes. So if you have an unhealthy gut, it can and likely will affect your mood and cognition and different things. And if things going on in your brain are sort of, not ideal, let's say, that can affect gut motility, secretion of enzymes, etc. So we often see, for example, people who have depression and other mood disorders have gut issues, and vice versa. I see my patients with inflammatory bowel disease, with Crohn's and ulcerative colitis, who typically have severe dysbiosis, that it has a dramatic impact on their mood. And in fact, people, a few decades ago used to talk about the IBD personality. Well, it's not like people with Crohn's and ulcerative colitis are, have bad personalities, but what it is that when you have serious disease in your gut, it affects your brain. And the beautiful thing is, as the gut heals, often things change in the brain too. So one of the things I see, and one of the things I most relish, is in a patient with Crohn's or ulcerative colitis, when their disease goes into remission, their mood is improved. They'll say, I'm not as depressed. my libido is better, I feel more joyful, whatever it is, right? So there's definitely that strong connection. And chances are you have felt that sensation of butterflies in your gut, right? Or like a bad feeling, like you have a decision to make and you just kind of feel in your gut, oh, this is not the right decision. Listen to that, because we have about 7 times as many nerve cells in our gut as we have in our spinal cord. Obviously not as many as we have in our central nervous system, but we talk about the enteric nervous system, the second brain in our gut. And there's a very close connection to the health of the central nervous system to the health of the gut, that enteric nervous system. So that's another connection there. So I hope I've given you a little bit of a foundation for how your gut microbiome can contribute to constipation and some things to do about that. And again, get outside in nature, get exposed to soil microbes, drink more water, and eat more plants. And then take a look in your medicine cabinet and really think about, with the help of your healthcare professional, getting rid of or decreasing any of those drugs that are not essential, because trust me, they all potentially have an impact on your gut, right? Many of these drugs. There was a study from the journal Nature in 2018 where they looked at 41 different classes of drugs, and they found that half of them had a negative impact on the gut microbiome. So not just the obvious ones like antibiotics and acid blockers, but also things like laxatives and hypertensive meds like beta blockers, etc. There was a recent article a few weeks ago in the sort of medical news about laxatives and dementia. This was a study from Britain, from the UK Biobank, of over 500,000 patients. And they found that people who identified as regular users of laxatives had significantly higher risk of dementia than those who were non-users or non-regular users. And people who used 2 or more different types of laxatives had as much as a 61% increased risk. It's actually one of our highlighted articles in the Gut Boost blog. We're back with that too. I have help. I have a wonderful woman named Olivia Ashton, who's a registered dietitian, who's helping me with courses, getting the Gut Boost blog back up, because this is a lot of work. And so the article about the association with laxatives and dementia was one of the featured articles. We also did a post about Ozempic, the weight loss drug, semaglutide, and the GI side effects. And then the third article was about bowel movements and constipation and what constitutes a normal bowel movement. So if you're not a subscriber to the Gut Bliss blog, go to the website, gutbliss.com or robinchutkan.com, and sign up. And it's just a newsletter in your inbox every couple of weeks. We don't sell you anything. We don't do anything with the information. But before I turn it over to questions, I do want to make a little plug for our course that's coming up. As you know, if you follow me, I am a huge advocate for providing as much free information as I can. That's why I do these office hours. And we have the blog, we have gut guides on the website. But we do have a paid course coming up. It's an evergreen course, so you can take it anytime, but it opens May 1st, and it's called Getting Regular. And it's a course I ran last year, but we have expanded it. It's a 4-week course, but you can do it at your own pace. You can do it in 4 days or 4 months, whatever you like. But we're recommending for a few hours a week. This would take about 4 weeks. And it is everything you need to know to get regular. So, definitions, causes, and most importantly, therapeutics. What are the tried and true things, from supplements like psyllium husk and acacia fiber, how much, when, etc., to things like biofeedback and lots of other therapeutics, as well as a 4-week meal plan, recipes, etc. So I'm really proud of the course. Olivia has done a great job helping me put it together, and it's Getting Regular. You can get a free sample of it actually if you go to the website, either one, gutbliss.com or robinchutkan.com, go to courses, and that will take you to a free sample of the course so you can get a sense of what the information is like. But I think it's great value. All right, so that's enough from me. Let us take some questions. Okay, let me go back and see what we have. So feel free to post some stuff. Hello to everybody. Okay, so it's not stuck, just bloat. Well, here's the thing. Now, there are lots of different things that cause bloating. I wrote a book called The Bloat Cure, about 101 of them. But I find that a lot of people who are bloated don't realize that they're constipated because they may be going every day, but it's incomplete evacuation, something called tenesmus. And I focus a lot on that in the course because tenesmus is one of the most common types of constipation that we're seeing these days, where people say, you know, I have a bowel movement 5 or 6 days a week, but I'm still full and uncomfortable and bloated. And we do some evaluation and find out that yes, they're going, but it's not all coming out. And that stool that's left behind is being fermented by bacteria and producing a lot of bloat and gas. So W3ST Coast, it may be stuck and bloat, or it could be just bloat. But one thing to consider is whether you're having nice, big, complete bowel movements or whether things are a little stingy. Okay. How long... This is Miller, KJ555. Hi there. How long does it take to get your microbiome back after antibiotics? It's a great question, but the answer is it depends. What antibiotics, how long did you take them for, and what's the background noise? And when I say the background noise, what's your diet been like over the last several years? What other medications do you take? What are your habits like? Were you born vaginally or via C-section? Were you breastfed? There are lots of things that go into that, because if you have a pretty healthy microbiome at baseline and you're an adult and you take a 5-day course of antibiotics, it's going to bounce back pretty quickly, usually within a couple of weeks. But if you are somebody who's been taking 5 or 6 courses of antibiotics every year for the last 10 years, plus you're on an acid blocker, plus you're not a good vegetable eater, plus you never get outside in nature, that might be a very different situation. But on average, and again, is it a narrow spectrum antibiotic like penicillin, or is it a broad spectrum antibiotic like a 3rd generation cephalosporin that's going to sort of kill everything in sight, right? So it depends on all these factors. In my second book, The Microbiome Solution, I have a section called 10 Things to Do After You've Been Prescribed an Antibiotic to help get back on track. And I do recommend a probiotic, in that, which, you know, may or may not help depending, but there's some other things too, like mushroom tea with maitake and shiitake mushrooms, and a bunch of other things that can help, including foods that can help support your liver after antibiotics, because many antibiotics are metabolized through the liver. So check out The Microbiome Solution for lots of help with that question. Okay. Let's see what else we have. Speaking of Olivia Ashton, she is on the call. Olivia, I'm so glad to have you helping me with these educational efforts, and I'm really proud of the work that we're doing together and the platform we're creating for people. So thanks for being here today also. Okay, use the squatty potty when on the throne. Yes, I am all for the squatty potty. And let me explain to people why the squatty potty works and what it is, in case you're unfamiliar. And let me just say, I don't have any affiliation with the company that makes squatty potties, so it could be anything. It could be books, but what they're referring to is elevating the knees up on the throne, okay? And again, you can do that. You can use a rubbish bin and turn it upside down and put your feet on it. You can use some old telephone books, because why else would you have telephone books around? But anything that brings the knees up into more of a squatting position, that helps to increase intra-abdominal pressure, which helps push the stool out. It also helps to adjust the angle of a muscle called the puborectalis muscle, which is kind of a sling that wraps around the rectum, and it has to release so that the rectum can straighten out. Normally it's held in a kind of bent angle so that stool doesn't leak out of your rectum or seep out or plop out, right? So the normal state is contracted. And in order for successful defecation to happen, the puborectalis muscle has to relax. And when that happens, it releases the angle of the rectum so that it's a straight shot. So this is some of the nitty gritty we're going to be going into in the course. And let me tell you, when you really understand how it works and you're armed with the tools, it is, you know, you can really get things going and become like a poo professional, get that stool nirvana going. And that's why, as I said at the beginning of this, there's so many different factors that can conspire to bloat you, to slow things down. And it may not just be one thing. So position might be a big thing for you, but there may be something else that you need to do also, right? So important to know about this stuff. And so whether it's a potty squatty, phone books, a rubbish bin turned upside down, what I like to do, because I consider myself flexible, is I like to bring my legs up onto the edge of the toilet seat, but you got to be careful that you don't fall over when you're doing that, right? Because you gotta be a little bit bendy, but that works really well too. Okay, what else do we have? Not all viruses and fungi are created equal. That's absolutely right. It's a great comment. Okay. A bad diet clogs. Yes, absolutely does clog you. All those ultra-processed foods tend to not move through your digestive tract with vim and vigor. Can I give examples of postbiotic foods? Okay, so let's clear up this definition. Postbiotics aren't foods. Postbiotics are metabolites made by the gut bacteria. Okay, prebiotics are food, and prebiotic foods would be things like oats and dandelion greens and celery and asparagus and all those sort of dense fibrous foods, and onions and garlic. Those are all probiotic foods, typically high in a kind of fiber called inulin. Those are prebiotics. The probiotics are the bacteria themselves, and the postbiotics are the metabolic byproducts. So things like short chain fatty acids and other things. So postbiotics are not food. They are products made, chemical messengers made by the bacteria. But I think you meant what are prebiotic foods. It gets confusing. I mean, it's like you have to have a PhD in this stuff, right, to really understand. So it's very easy to confuse a post and the pre and the pro and all of that. One of the things with probiotics that I like to point out is that the definition by the World Health Organization of a probiotic is bacteria that, when ingested, confer a benefit to the host, which means that 99% of the stuff out there that people are selling is not actually a probiotic because it does not confer any benefit to us, the host. So it's something that you take that actually is beneficial. Beneficial because it actually does something, not because the label says what it's going to do. And probiotics also refer to our body's own indigenous bacteria, the bacteria that are in our guts already. And those are the ones we should pay attention to, because those are the ones that are already there and are already sort of mobbed up in our gut, right? That are already embedded in our colonic mucosa and the lining and in the gut lumen. And that we just need to feed for them to reproduce and repopulate. And remember, the lifespan of a bacteria is very short. I mean, their reproductive cycle is, depending on the species, 15, 45 minutes, an hour. So you can really start to, multiply and enhance these levels of good bacteria with what you eat. Okay, let me see what else we have. Olivia liked my cheetah example. Yeah, here's the thing. I really don't like zoos. When our daughter was younger, we lived very near the zoo, and there'd always be some school trip or something to the zoo. And every now and again, I'd chaperone, and then I'd cry. I'd start sobbing. And my daughter, she was like 8 or 9, but she said to me, "Mommy, don't come. Just don't come." Because I would see the poor lion in the cage looking, so depressed. And I would just cry, and I would say, this just isn't right. Like, why are we taking these animals from their natural habitat and locking them up in these fake natural habitats for our enjoyment and pleasure? But she banned me. She was like, you cannot chaperone, do not come. Daddy and I are going to go see zoo lights over the holidays and just stay home. No sobbing at the zoo. But that's what made me think too, because of course, when you take these animals from their natural habitat and you put them in a cage that you pretend is an African savanna, they stop reproducing and they die, right? They literally get depressed and die, and they don't reproduce. And, you just see them, they look terrible. And so, kind of the same thing with our gut, right? There's an analogy to be made. You can't just go borrow some bacteria from your vegan friend and then continue to eat Cheetos daily and think that, okay, I'm good, right? I borrowed some good gut bacteria, had a fecal transplant, or I took a probiotic. And there are several studies looking at what we call FMT, fecal microbiota transplantation, where we literally borrow healthy microbes from somebody and insert them, usually rectally through a colonoscopy, but sometimes through capsules. And what we see is that this can change the microbiome temporarily, but over the long term, this really doesn't work. So it can work for an acute problem like C. diff infection, Clostridium difficile infection, or a traveler's diarrhea. But for a more chronic problem like chronic constipation or autoimmune diseases, this on its own tends to be ineffective without the dietary change. Okay, what else do we have? Let me keep scrolling. I wish I could see you guys. I always say that. I liked when I did this on Zoom. Hello from Dublin, Ireland. Dee's Woodshop. Hello, Dee's Woodshop. I have never been to Ireland, but I'm dying to go. Little known fact though, I was conceived in Edinburgh. My dad was doing his medical training at the Royal College of Surgeons, and my mom came up for a conjugal visit from Jamaica. I already had an older brother and sister, and my dad was too embarrassed to go out and buy prophylactics. So here I came, and when my mom went back to Jamaica, and then a few months later, it was clear she was pregnant, and people didn't know that she'd been up to visit my dad, and everybody was sort of like, he's in Edinburgh, and she's in Jamaica, and she's pregnant, what's going on? But it was because of the conjugal visit. So that's my Scotland story, but I'm dying to go to Ireland, so thank you so much for joining. And you know, people say the Jamaican accent is a little bit like the Irish accent, so I understand Irish people very well, even with a very thick accent. All right, who else do we have? Question-wise. Okay, here's a question from Nicole. Is magnesium citrate considered a laxative that was seen to contribute to dementia? And Nicole, you're talking about magnesium citrate capsules. So the laxatives that were most egregious, if you will, in that study were what we call the stimulant laxatives. So those are things containing senna that stimulate the gut to contract. And those have been found to be the most disruptive to the gut microbiome, because that is really sort of the operating theory, right, for how these laxatives are associated with dementia. And you notice I said associated with, I didn't say cause, because again, that it's very difficult to prove causation, but there's definitely an association, is classes of drugs like these stimulant laxatives that contain senna that really change the composition of the microbiome. But, you know, some of the osmotic cathartics were also implicated. So I consider magnesium citrate to be a safe laxative, but none of these things are safe really for everyday use. Now, psyllium husk, which is just fiber, it's ground up plant fiber. Plantago ovato is a plant, and it's a ground up husk. That's, I mean, we call it a laxative, but it's a bulking agent. So magnesium citrate, I use different forms of magnesium in my practice, usually in combination with a fiber supplement and always in conjunction with dietary change. But the goal, Nicole, is to get you off the magnesium, right? This isn't something that ideally we want you taking every day. It's better than something like Miralax to take every day, but still ideally not a great idea to take it every day, because we really don't know the long-term effects of some of these substances. And when we think about the body's homeostasis, which is really the balance, right? When you are taking an exogenous source of magnesium, now your body has magnesium in it naturally, and there's magnesium in certain foods, but when you're taking a high dose of magnesium, that can affect the calcium metabolism in the body. And so these are digestive aids that in my 30 years of experience, I think are pretty safe. But the goal is always, what can we do through diet and lifestyle so that you don't have to take a magnesium citrate capsule every day? But yeah, that wasn't one of the ones that was high on the list for the Dementia Association. Thank you for asking. Carrie wants to know, hi Carrie, it's good to see you. Do we recommend the new course if you took Getting Regular last year? I don't think so. I know I'm supposed to say yes, and Olivia's like, what is she doing? Of course you should take it. But in all honesty, even though that was a one-day course last time, you had that pretty comprehensive PDF. And even though we take a deeper dive into a lot of the information, like a lot of the things that were just a passing mention are now their own module. They have an audio piece, they have a video piece. I think you got a lot of it with Getting Regular. So I'm not a good salesperson because I'm supposed to say yes, but I think you're good. And thank you for joining me today and on so often of these. It's always great to see you. Okay, ended PPI, that's a proton pump inhibitor for those who may be less familiar. And so that's the sort of quintessential aggressive acid blocker that shuts down the proton pump in the stomach and blocks acid completely and is associated with so much mischief in the gut, including an increased risk of COVID, dysbiosis, etc. And why is that? Because stomach acid is so essential to digestion. It's digestion 101. If you do not have stomach acid, you cannot have proper digestion. And that's why we see such a range of side effects from blocking stomach acid, from, again, disrupted gut microbiome, dysbiosis, to kidney disease, to dementia, to osteoporosis, bone fractures, etc. Because it means that you're not having proper digestion, you're not having proper assimilation of nutrients. Stomach acid provides the ideal pH for those nutrients to be assimilated and absorbed. And that means that the gut engine that feeds all these different organs, your brain, your kidneys, your bones, is not providing optimal fuel. And that's why the side effects are so far reaching. So to get back to your question, ended PPI 2 months ago after reading 3 of your books. Oh, thank you. And watching your lives. I do feel like I've done something good there. Still dealing with leaky gut. Tried rifaximin twice, November, December. Eat well over 30 varieties of grown foods. So here's the thing. The rifaximin you're talking about, again, that's the antibiotic that's often used for small intestinal bacterial overgrowth, which in my experience, and I have a lot of it, really doesn't get anybody to the finish line in the long term. Not surprisingly, because that's just killing off more bacteria. And yes, is it maybe killing off some of the species that are overgrown? Sure, but it's not addressing the root of the problem, which is the missing species. So, it's hard for me to give you advice without really knowing what your symptoms are, right? Because when you just say leaky gut, that just means an increase in intestinal permeability. And you can have no symptoms from that, and you can have a wide variety of symptoms, some of which are maybe not necessarily related to the leaky gut. So I'd really have to know a little bit more. And my approach with patients is always to focus on the symptoms. Not to, people come in and they're like, I have this, and that. And I was like, okay, but what are your symptoms? What are the things that are bothering you that you're trying to fix? Because what we find is that practitioners give things a lot of different names, and sometimes they're correct and sometimes they're not. And so I'll give you an example of this. I saw a lovely woman in her 20s recently in the last month or two, and she was having terrible diarrhea. And when I say terrible, like multiple loose stools a day that did not smell like how stool is supposed to smell. And she had been given a lot of different diagnoses by functional medicine folks, but it turned out she had an autoimmune disease called lymphocytic colitis, where the lining of the colon is infiltrated with lymphocytes, a type of white blood cell, and there's not proper absorption of fluid. And so I always caution about assigning these diagnoses to symptoms without really doing a thorough evaluation. And maybe you have had a thorough evaluation, but in her case, she hadn't, because she hadn't had a colonoscopy with biopsies. And when we did the colonoscopy, we got the biopsies, it was very clear that this is what was going on. And that is a very different fix from something like leaky gut or Sibo, etc. So I like to hone in on the symptoms and really evaluate the symptoms and treat the symptoms, and ideally uncover the root cause of the symptoms, rather than just think about, what I find, honestly, and, this may seem a little not generous to say, but I find that so much of the time, these diagnoses are applied to sell you something. Like, oh, you have leaky gut, here's, $700 worth of supplements. And I see a lot of that going on out there. And while I think a lot of functional medicine practitioners are very thoughtful and so on, I do see an over-reliance on testing that, in my opinion and experience, is not particularly useful or reliable, and an over-reliance on some of these supplements, which I said sometimes the same thing applies. So I'm really glad to hear you're eating well over 30 varieties of foods that are grown, plant foods. But what I would recommend, and I'm glad you stopped the PPI, and I hope that was with the help of your healthcare practitioner, but that is monumental in terms of your overall health, getting off those drugs, because, as I said, they affect brain health, gut health, immune health, kidney health, bone health, etc. What I would recommend is, if you have not, to get a proper GI evaluation for what you are calling leaky gut. And it may be that the only thing going on is an increase in intestinal permeability, but maybe there's something else going on that hasn't been identified that could be addressed. Okay, from Herbivore. If you eat a plant-based diet with decent variety, greater than 30 different plant types per week, are probiotic capsules still beneficial? Seeing many ads for seed, etc., and don't know how necessary they are. Hint, this is what I'm thinking. Yeah, we really don't have evidence that for the average healthy person, a general probiotic of the kind that are sold over the counter and aggressively marketed to you really do anything. We have some great information from the Weizmann Institute in Israel that showed that probably are doing nothing. And in fact, may be causing problems sometimes in terms of competing for nutrients, etc. That being said, we have certain probiotics, and there's certain ones I use in prescription doses that have an indication, that actually have an FDA approved indication as medicinal foods for certain conditions. For example, for a condition called pouchitis, after the colon has been removed in people with ulcerative colitis, where the remaining intestinal segment, you can see overgrowth of bacteria and things going on, and inflammation, bleeding, diarrhea, and they have a medical indication from clinical trials that they have done. There are probiotics with a medical indication for traveler's diarrhea, for a condition called necrotizing enterocolitis, which can be a severe and even fatal diarrheal illness, particularly in children. So there is data for certain conditions and certain types of probiotics, but they're typically not the kind that you're, buying at the health food store, etc. And in terms of just overall improving your health, we don't have data for that. The same with vitamins. We don't have data that a multivitamin does anything other than make your pee smell funny and put an additional strain on your liver for metabolizing it. But we do have data that if your vitamin D levels are low, having a normal vitamin D level can improve health. We have data that if you have Crohn's disease and you're not absorbing B12, because a part of your intestine where B12 is absorbed, the ileum, is diseased, and you have low B12, that supplementing B12 can be helpful. We have data that if your vitamin K levels are low and your blood isn't clotting, you might use a vitamin K supplement. And by the way, what makes the vitamin K levels low? Antibiotics. So we have evidence that in specific situations, if you are a young woman and you have heavy menses and you end up being anemic and have low iron, iron supplementation can help. But this idea that just generically taking a probiotic is going to improve your health, we don't have data for that. Tablespoon of sauerkraut. We have great data from the Sonnenbergs, Justin Sonnenberg and his wife, who are fantastic microbiome researchers at Stanford, have done a lot of the research on fermented foods, and we have some really good data for that. So I'd recommend, instead of the probiotic, you go to the farmer's market or you make your own sauerkraut. I'm not a particularly good fermenter. Everything tends to turn really moldy with me, but make a little bit of sauerkraut or buy some, and that, incredible in terms of a food like sauerkraut, a fermented food, is a triple threat because, or a triple, like J-Lo, in the sense that she can do 3 different things. She can sing, dance, and maybe act. So what does a fermented food like sauerkraut provide? It provides prebiotics, because the cabbage itself that the sauerkraut is made out of is a high fiber food that feeds gut bacteria. It provides probiotics, the live bacteria themselves, because as the fiber is being fermented in the fermentation process, there's a lot of lactobacillus being produced. And it provides postbiotics because, again, during the fermentation process, those chemical messengers, those postbiotics are being made, those metabolic byproducts of bacteria. So it's a combination powerhouse of pre, pro, and postbiotics that taking a probiotic capsule is not going to do. So that is, that's my opinion. But, the millions of dollars being spent on marketing, these products are marketed very aggressively, and they have marketing data that's sort of masquerading as research. And so it's very important to look for placebo-controlled clinical trials and read from the medical journals, not from the product website. So what I would say is, if the product website is not, and here's the thing too, they're often referencing other studies looking at the bacteria, which is not the same as the product itself. So it's that sort of deductive reasoning, right? So for example, saying, well, high levels of bifidobacteria are associated with faster gut motility, therefore our product that contains bifidobacteria is going to improve your gut motility. Well, that's not accounting for the fact that people who have higher levels of bifidobacteria are eating more plants or something else, right? So it's that sort of saying, well, because this bacteria in a study was associated with this symptom, therefore our product can fix that symptom. And I see a lot of that. So save your money and eat some more plants instead. Okay. Does a topical prescription antibiotic cream have an adverse effect on the microbiome? Yes, it can, because those topical antibiotics are absorbed. So for example, we see that eye drops, topical antibiotic eye drops, affect the eye microbiome negatively. But a topical cream is typically going to be less destructive to the gut microbiome than an oral systemic antibiotic that you're taking. So it is a lesser of two evils in this case. And so if you have an infection or something you're treating and you can get away with a topical cream over an oral antibiotic, it is preferable. But yes, it can still have a negative effect. Great question. Thank you for that. Okay, so question, leaky gut and IBS, what's my take? That's a whole other office hours. And I promise you, I feel like I could do leaky gut every week and it still wouldn't be enough. So I promise you that that's coming up. And also take a look at archived office hours on gutbliss.com, because you'll see that I've done both of those before. And so those are, pretty, most of them are an hour. So you could go back and take a look. But I promise you, I'm going to do it again. All right, what else do we have? What is this issue when poop floats? Oh, thank you so much for that. So here's the thing. First of all, what is stool, right? It is a lot of things. It's a lot of dead bacteria, red blood cells, etc., plant material. And whether it floats or not can depend a lot on the composition. What we typically see with fat malabsorption in people who have issues with the pancreas is, first of all, they're losing weight. So if I had $1 for every patient who comes in saying to me, I can't lose weight and I think I have malabsorption, I will tell you that those two things don't go together very typically, because when there's fat malabsorption, there's general caloric malabsorption, and the problem is you are having trouble maintaining your weight and you're losing weight. With that, you will often see what we call a floating, fatty, frothy stool. But it's not just floating. There's obvious oil with that. I have had the good fortune to see many stools in people who have pancreatic insufficiency, and it is a very weird looking stool. It's often kind of orangey in color because they're not normal amounts of bile, the green stuff that turns stool brown, and it's floating and there's oil literally. And it's also sometimes very frothy and kind of sudsy looking. If you have a fairly normal stool and it just happens to float, that can have a lot to do with the amount of gas in the stool, how well aerated it is. And so a floating stool is not necessarily a sign of something abnormal. Now, my ideal stool, and I talk about stool nirvana in my first book, Gut Bliss, is a dense stool. It's bulky because there's a lot of plant material in it. It's got almost a greenish tinge because you're eating so many plants, and it tends to fall down to the bottom. But that does not mean if you have a floating stool that is necessarily abnormal. Okay, now if you have a floating stool, it's also frothy and oily, then that's a different situation. You need to have an evaluation for that. Brian wants to know, is stevia bad for the gut microbiome? Yes, it is. Stevia is a non-nutritive sweetener, meaning you get sweetness and no calories. It is not as bad as aspartame and some of the other older artificial sweeteners. And what we find with those artificial sweeteners is that many of them really disrupt the gut microbiome, but others of them, including stevia, interfere with communication between the gut bacteria. And that communication is essential for successful production of neurotransmitters, etc. So I unequivocally will tell you that stevia is bad for your gut microbiome, and that you are much better off just using a little regular sugar or honey or maple syrup or whatever, a little bit, right? Not a lot, because a lot of sugar, etc. is not good, but food over chemicals. And even though the marketing, stevia, it's made from this natural leaf, etc. Stevia is a chemical compound, a chemical non-nutritive sweetener. And, I have to say, I am shocked and I'm really appalled at the campaigning. I see it on television, etc., pushing these non-nutritive sweeteners. Oh, we're really committed to, who I'm talking about, all the soft drink manufacturers and the ultra-processed food manufacturers. We're really committed to making food with low sugar, full of chemicals. So eat some real sugar over those chemicals any day. But ideally, an Oreo with sugar versus an Oreo with a non-nutritive sweetener, they're both Oreos, right? This is not health food. But if you're talking about, in your coffee or in your tea, whether you should use stevia or a nutritive sweetener, pick the nutritive sweetener, the one that has some calories, but less chemicals. Thank you for that question. Okay. Is it good to take Metamucil capsules daily? For Metamucil, for those who don't know, is typically psyllium husk. The psyllium I was talking about earlier, that ground up fiber made from the husk of Plantago ovato. And it comes in a powder form and a capsule form. What I have found in my patients is that the capsules tend to not dissolve well, and they tend to sort of gum up in the gut. Now, a lot of people just don't tolerate the powder as well because it can taste a little bit like you're drinking grated up cardboard. So what I will recommend for my patients is to use ground up psyllium husk and add a splash of something, just a splash, a little lemonade or orange juice or something to give it some flavor, and use a lot of water. The Metamucil, you have to make sure it's not the Metamucil with the artificial sweeteners because there are many different brands and a lot of them have artificial sweetener in them, and some of them have coloring, FD&C, yellow number 5, etc. So you want to find the one with the least amount of chemicals. And what I tell people is look for just ground psyllium husk without anything else in the ingredients. But again, just that plain ground psyllium husk can be a little bit difficult to tolerate. So here's the deal. If you're taking Metamucil capsules daily, ones without the artificial sweetener, and they are helping you have an effective bowel movement every day, I think that's fine. Okay, we're going to take one more and then I have to go. Is there an ideal number of times to poop in a day? At least once. Now the definition, I'm so glad you asked that, Milgy too, who's my sister from another mister, Michelle Ray. Here's the deal. The textbook definition of constipation is fewer than 3 bowel movements per week. But you can have a bowel movement every single day and still be constipated if the bowel movement is incomplete, meaning you go and you're like, oh, I can tell there's still stuff in there. If you are straining, all of these things. So while that's a textbook definition, a lot of it depends on, probably the most important question is, how do you feel after you've had the bowel movement? Do you feel like you've gotten rid of it all, or do you feel like you still have to go? But what I want to leave you with is, if you are eating every day, you need to be eliminating every day. And if that is not happening, check out my course, Getting Regular, so I can help you achieve stool nirvana. So thank you all for being with me. I have to tell you, it's kind of weird just talking into this phone, but I see you there. I see your names, so I know people are there. And, maybe one day you can all come over and we can meet in person. Wouldn't that be fantastic? But until then, dirt, sweat, veg. Get outside in nature, get sweaty, eat some vegetables, and drink some water.